Hello, this is Dr. Stanley Lang and welcome to this video. This video is for the stressed, busy woman who is also having symptoms of brain fog, possibly anxiety that's magnifying the brain fog, who wants to learn a technique that I'll be teaching in this video about how to control the anxiety very quickly using some simple breath work. Now, we'll be using a strategy that is being taught elsewhere on the internet. In my opinion, it's being taught in ways that are less useful than the version I'm going to teach you today. It is called the physiologic sigh, and I'm going to briefly review that and then explain why it's actually not the physiologic sigh. Then I'll teach you how to use it in a way that you can use it discreetly without signaling to other people that you're having anxiety. So the physiologic sigh comes from an old phrase in medicine that describes a way of breathing that we have that every once in a while our body causes us to take a deep breath that allows the lungs to fully expand. So the reason we need to do this every once in a while is because our lungs have so much extra capacity for, like, when we're exercising or doing something that requires a lot of extra lung work, that we have this extra reserve that we don't need when we're not doing that kind of activity. So our lungs don't fully expand all of the time when we're just sitting around. So the physiologic sigh is basically designed to, every once in a while, expand our lungs so that they continue to be healthy. If we didn't have that sigh built in, then our lungs would start to become sick. And so every once in a while you'll notice yourself taking a deep breath. Every once in a while you'll notice somebody else just taking a deep breath, and they're not even paying attention because it's all subconscious. So fortunately we don't have to think about taking this breath every once in a while. Our brain takes care of it for us. Well, the people that are teaching this technique as a stress-reducing technique are borrowing the term physiologic sigh, and they are using some of what's going on with that physiologic sigh, which is to take a really deep breath, and then they teach you to take a second breath on top of that, and then you exhale very slowly. Now, that does work, but the problem is, for most people that are having anxiety, when you take that kind of breathing and there are people around you, they notice immediately that you're breathing kind of funny. And you yourself will have some increased self-consciousness that will keep you from doing the technique in its best way anyway. So I'm going to show you how to do this technique the way that's usually taught and the way that I'm going to suggest you do instead. So the way it's usually taught is that you take a deep breath followed by a second sort of a stutter breath, and then you exhale very slowly, and then you might do that again a second time. So this is what it would look like. You would be breathing normally, then you take a deep breath and a second stutter breath, then exhale. Now you could do that through your nose. You can do it through your mouth. Either way would work to trigger this parasympathetic relaxation phase to sort of turn on. Now when you take that first deep breath and then the second one, that's where it becomes real obvious that something's going on in your life, and you're not too likely to want to use that technique if you're around other people. They're going to ask you what's going on, and so you probably won't use it, so you'll just sit there being anxious. So instead of taking this deep breath through your mouth, I'm going to suggest that you breathe in through your nose a little bit more slowly, but still it's a deep breath, and you're going to take a deep breath through the nose without worrying about that second stutter breath. Just you're going to breathe deeply until your lungs are expanded, and then you're going to exhale slowly through your nose. So it'll look something like this. Now, I think you'll agree that you could probably do that discreetly without anybody around you noticing that something was funny. And so, again, you're just going to breathe in through your nose quickly, so that your lungs are fully expanded. That's the whole idea here, is that you're going to fully expand your lungs through your nose. And you're going to exhale naturally. You're not forcing the air out. You're just letting the air flow out. But as your lungs become empty, you're going to push a little bit more out. This is how that would go. And this is where I'm going to start pushing the air out a little bit more, again through my nose. I'm doing that so that my lungs are more empty, so that the next deep breath happens a little bit more naturally, because my lungs were totally empty because they squeezed all of the extra air out. So I take that second deep breath, and exhale slowly. So that second exhalation will take about 10 seconds or so. Now the idea behind this is that you're going to time this physiologic breath, this physiologic sigh, you're going to time it to last about 15 seconds. So it takes about 2 to 3 seconds to inhale, and then you're going to be using about 12 seconds exhaling, more or less. You know, you don't have to be counting exactly, but that's approximately what you're going to be aiming for. And the reason will be obvious, because I'm going to teach you how this leads into a second breathing technique that you can do all day long that is very powerful in terms of reducing the chronic stress that you're experiencing, and decreasing the anxiety that you might be experiencing. So how often can you do this physiologic sigh? Well, you could actually do it all day long, as long as you didn't do it too frequently, because as I mentioned in the first video on this series, people hyperventilate because they start sighing too frequently. And if you start taking this sigh too frequently, your carbon dioxide levels will drop too low, and your brain will not like that, and it'll trigger you to feel shorter breath, and you'll take even more deep breaths, and you'll feel more anxious. So you want to breathe slowly enough to not trigger that. So the frequency that will guarantee pretty much that you will not hyperventilate, that means breathe too much, by doing this technique, it's about 4 breaths a minute. So you could do this physiologic sigh four breaths a minute. You could do that, but in my experience, that doesn't work real well as a long-term strategy for dealing with anxiety. What that does work well for is to do something doing that occasionally. Like if you're in a bit of a nervous situation, a meeting perhaps, but you still have to be paying a lot of attention to what's going on, you could take 2 of those physiologic sighs, the modified physiologic sigh that I just demonstrated, without people noticing what you're doing as a technique, and it would fairly quickly decrease your stress sensation, but you wouldn't be moving into a long-term strategy at that moment. However, if you have the time or the situation where you could move into a longer-term strategy, this is what it would look like. You would, and you'll see if you can see me transition. So I would start with this modified physiologic sigh. Instead of the big gasp, I'm going to take a deep breath through my nose. And then the second breath. And this is where I'm going to transition to the second technique. The second technique is 4 breaths a minute. And the way this works is very simple. I've been teaching this for a lot of years to my patients as a way to deal with anxiety and hyperventilation. And you're basically going to breathe 4 times a minute. You're going to breathe 7 seconds in and 7 seconds out, very slowly. So see if you can see me even taking these deep breaths. So I just took two of those 15-second breaths, and what you'd notice, or maybe you didn't notice, but I'll just point out, you didn't see me doing this because it was all abdominal breathing. You can do that 7 seconds in, 7 seconds out with abdominal breathing only, which helps to relax you even more. You will get some upper chest movement, but not the kind of obvious upper chest breathing that signals that you're having an anxiety attack. Rather, you're emphasizing the abdominal slow breath, 7 seconds in, 7 seconds out. So if you combine this physiologic sigh, where you do 1 or 2 of those sighs, when you're having a little bit more anxiety, that will rapidly decrease anxiety right then. But if you want to transition into a longer-term strategy through the day, what I just taught you with that 4 breaths a minute, essentially 7.5 seconds per in and out, you can do that all day long. In fact, I do that all day long when I become conscious of what I'm doing. And so this is a very simple strategy to regulate anxiety, to regulate your breathing so that you're not over-breathing from anxiety. And that will decrease your brain fog sensation a lot because anxiety isn't feeding into it and magnifying it. Now that still doesn't answer why is the brain fog there in the first place. There's a lot of different reasons why that might be, and we do go into that quite a bit in our program, which I invite you to look at if you're interested in more information, because this webinar that is basically free to you will go into these techniques I've just talked about and quite a bit more that will help to uncover what you can do to have a lot more peace in your life, better control of anxiety, a much clearer thinking, improvement in the brain fog, improvement in focus. All of these things are part of what happens with the program that we have, which I encourage you to take advantage of the webinar because it's free. So I wish you well, God bless, and have a great day.